I did an externship at an exotics practice, and I had a cockatoo latch on to my thumb and not let go. And they can crush bones like butter, is what I was told.
It was animals biting people, nurses and owners. But anyway, we got through it.
I had to spay and neuter a rabbit during my interview. So
no better way to test your skills.
Holy crap.
Hello, everyone, and welcome to another episode of the Veterinary Roundtable, the podcast where we answer your veterinary-related questions while having some fun along the way. If you enjoyed today's episode or a previous episode, be sure to leave us a review on your podcast provider of choice. And if you have any feedback to improve the Veterinary Roundtable, let us know with a review.
If her voice sounded different,
I am not King.
She is not Dr. Emily King.
Who figured it out how
we'll
quickly.
get there. We'll get there if who's here and why.
Okay.
Hammer home, Devin.
Hammer home. Okay, reviews. Last week we were at 269 on Spotify. Now we're at 270. That one. Oh, and same thing with Apple Podcasts. Like last week we were at 113. Now we're at 114. So those two reviews.
Thank you
so much.
Thanks so much
Better
for
than
hanging
none.
in there.
Hopefully they're nice.
Yeah, we always hope that, but
Yes.
it is what it
A
is if
review's
they're
a
not.
review.
We learn from it if they're not.
Mm-hmm.
Yeah.
Mm-hmm.
We get better on here.
Mm-hmm.
Okay, pie video coming soon. You want to?
Yes, we have a date. It is, I don't know the date, but it is.
It's next Wednesday.
I know a Wednesday, but I don't know the date. It is Wednesday, November 13th. We don't have a time or like specific location yet, but we will be at Purdue on Wednesday the 13th. So do your studying.
Yep.
Get ready to pie me in the face.
So basically the summary is we told our listeners if we reached 100 reviews on Apple Podcasts, then we would do something. And then it turned into Devin doing something where it was just Devin having to do. So we tossed around a milk mile where she had to chug milk and then run a mile.
So long ago.
I know.
It started back at the old studio.
Yeah, this has been going on because it took a while to get here.
Yes.
And then we said we were going to put food and cheese on her and dogs have to lick it off. So we ended up with going into public and asking
my favorite.
asking animal related questions to people, and if they get it right, they have to pie her in the face with whipped cream.
They don't have to. They get to.
They get
have
to. That's very important.
Yes.
They don't have to.
So you're going to Purdue? Okay, because last time we heard you were going to IVC. Yeah, but Purdue's more of like a campus setting. So
yeah,
that's the plan.
So the vet school?
That's what I said. We should,
Like that would obviously be ideal, but we'll just have to look at their schedule and see what it's like.
Yeah, I know.
Very fun.
I know. For Devin. We love her.
Oh.
Are you eating popcorn?
It's going to be freezing. Yeah? Oh, okay. I was just wondering.
That's a good idea. We should make popcorn next time.
We should get a microwave.
Okay, promote our new socials. So follow us on Instagram and TikTok at the Veterinary Roundtable. We have a new YouTube channel where all the video podcasts are published going forward. It's the Veterinary Roundtable.
Mm-hmm.
I'm Dr. Ashlyn Duckwall.
I'm Devin Fortune. I'm Courtney Allen. And we have a special guest here. If you're watching, you probably already saw her. But if you're listening, we have somebody if you'd like to introduce yourself.
Yeah, I'm Mary Lempert.
Doctor
Mary Lempert, I forgot. And I am the newest doctor, All-Star.
Woo! We love her.
Yep.
Aw,
What do you see?
Thanks. So I see dogs and cats, and I see exotics. So
there it is.
Yep,
Keyword.
there it is.
Very exciting.
So we now see all sorts of species except birds. We don't see the birds.
Is that because you don't favor them or we're just not like you didn't study them?
When I was a fourth-year vet student, I did an externship at an exotics practice, and I had a cockatoo
Oh dear.
latch on to my thumb and not let go. And they can crush bones like butter, is what I was told.
Oh.
It really hurt. And that was the time. It's fine. It probably bled a little bit.
And that's when you ixnayed the birds.
But that's when I was like, this is a dangerous species. And if I could avoid working with them, I would like that. So when I graduated Purdue in 2016, I moved to Austin, Texas to work at a practice that specialized in exotics. but did not see birds. So that was kind
So
of
it's
like
possible.
a perfect.
Yeah.
Oh yeah, it's actually very possible.
Okay.
And I loved that practice. I worked there for 7 years and got a lot of experience with exotics, especially rabbits and guinea pigs and ferrets and those like furry exotic mammals. And so when we moved back to Indiana a year ago, I took some time to find a practice that I could kind of mesh well with, and I'm here now.
Yay!
Yeah,
We're so happy
so
to have her.
excited.
Yes, it's really fun.
I
Getting
was
to see all the little
terrified.
creatures that come in.
Yeah, I was worried it would be like spiders and scary stuff and snakes.
Someone has asked about seeing a tarantula.
No.
And I said I would do it.
Oh,
Ashley
she
Davidson
does.
has a tarantula.
She does.
She
Someone
just
else
got
has
one.
said it, too.
Ashley Davidson, she got a new one.
I literally have goosebumps because I'm terrified of them. Like I couldn't see them.
You've seen a lot of snakes.
We've seen a lot of
Yes.
snakes, which
Mhm.
has been upsetting for some people.
Oh yeah,
Me
that's-
included.
Yeah, 'cause-
Really?
I don't like snakes.
Oh,
I love snakes. I've come
Yeah,
to
me,
find
I'm really
out
upset
about
about
it,
it,
but I
okay.
don't like snakes.
okay.
I like the little lizards that
Yeah.
we get to see in the
Mhm.
surgeries
Yeah,
you do.
I
Oh.
have learned that rats can be cute.
Rats are so cute. I almost got a rat before I got my guinea pig. I love rats, and they're
Rats-
so smart.
Rats are amazing.
But they're so fun to have.
Yeah,
Because we
yeah.
had them in school.
Yeah.
And we had one named Creek. And during classes, we would all go get her out of her cage, and she would sit in our sweatshirts during class.
Yeah,
She was the
they're
best. She was
very
so
underrated. A lot
Oh,
of these
yeah.
exotics are underrated because they're just kept in cages, and people don't really kind of get to know them and realize how much personality they have.
They're
so.
cool.
Hamsters yet?
What's that?
Have you seen hamsters
We
at All-Star?
have, yeah.
You have?
Yeah.
I feel like I've just seen your bunnies, your guinea pigs, your rats,
Snakes,
geckos.
geckos.
I haven't seen a
Anything
ferret
else?
yet. I mean, I've seen
We
them.
we had
Not by you,
We've had a
but-
couple ferrets.
You're seeing my brother's ferret next week.
I know. I was gonna say he was on the schedule to come
Mochi.
in on
Tuesday.
Tuesday. Nope, Monday. Today's
Next Tuesday. Next Tuesday.
Yeah, because that's
He's
your day
coming
off.
in now.
Yes, because I'm
Tuesday.
coming with him because it's my day off.
Are you coming with me?
I want to see what you do to him. And I want to be like that
can't
because
wait.
if he was coming in on a day where I worked, I might get pulled away. So I
Yeah.
want to help
Yeah.
with them.
That's awesome.
Mhm.
I can't wait.
It's so fascinating.
Yeah.
So okay, you found out your love for exotics in
Mhm.
vet school or like before vet school?
Oh, that's a good question. So I actually had a previous career working in writing and publishing. And
What?
So I was always an animal person, and I fell in love with rabbits. I don't know. It was a long time ago. I was in high school.
Okay.
Actually,
Yeah.
when I got my first rabbit, and then I snuck a rabbit into college.
Nice.
In the dorms? Is
Into
that
the
why you
dorms.
snuck
Everybody
it?
does
Yeah.
that.
And she lived to be 13, and
Oh my god.
inspired me to go to
Wow.
vet school.
That's unheard of.
Yeah,
That's
they
crazy.
can live that long.
Oh,
Yeah,
really?
That's like
I just feel like they
that's
don't. I don't
My
know.
rabbit did
Yeah.
not live that long.
Oh no,
I don't have good luck with animals. I don't think. All mine die young.
Wow. What was her
That's
name?
awesome.
Her name was Gracie.
And what kind of rabbit?
She was a mini lop. She was white and gray, and she was like my soul bun. She was with me through college,
Wow, that's
marriage,
amazing.
vet school, after vet school,
Oh,
my
wow,
first
yeah.
real
Wow.
job. So
All the big things.
all the big things.
Yeah.
I went to grad school after college to get my master's in writing, and she was there for that in Boston. Like she
Aw.
traveled
Oh,
the
wow.
United
Gosh.
States. So
Okay.
so she was really special.
Yeah.
And so I always knew, and when I applied to vet school, I during the interview I talked about how I wanted to be a rabbit specialist, and I think I kind of got laughed at a little bit. But here I am.
Oh
Yeah.
my gosh.
That's
Now look at
awesome.
me.
Hmm.
So,
Wow.
Follow
That's-
your dreams.
So did you go, what got you to Texas and then what brought you back?
So the job in Texas, so it was in Austin, essentially. They were, my fourth year of vet school, I've been looking for jobs, and they were essentially advertising for a vet that wanted to work with rabbits. And
Oh.
they wanted someone who'd had 3 years of experience at least. And I was still in vet school, but I applied anyway. I said, I'm the girl for this job. Just trust
Good
me.
for you.
So, and then, I got hired. I had to spay and neuter a rabbit during my interview. So
no better way to test your skills.
Holy crap.
And so, and it was a really great job.
Yeah.
And we moved back here because my parents live here. And we had a baby, a human baby. And
I love how we have to like make sure we clarify.
And so it's been great having their help nearby.
Yeah.
Yeah.
So interesting. Learn more
We're
stuff
happy you
about
came to
you.
Indiana.
Yes, we are very
Yeah,
happy.
I know much of that. Yeah. I grew up in Indiana, so it's
Okay.
Yeah.
You're back.
So this weather is probably creeping everybody out because it's like really warm
Hot.
still.
Well, it got cold for like 2 seconds.
I know.
It's like, just kidding.
I know.
I'm
'Cause
all
I was
about the
excited.
rain, but
I was
70
excited about
degrees
the
in
cold.
November is ridiculous.
Yeah, it's kind of weird.
I was
I'm sick of
excited
it.
when it got cold because my house got cold
Yeah.
and I slept good.
Yeah.
I sleep
that's
better when it's
true.
cold.
That's a good point.
I just like the cold weather.
Yeah.
Mm,
I don't
I'm
like
like good
I
with
want to be able
it.
to bundle up. And
I
wear
don't
coats.
like
70
cold.
is like my ideal, so I'm good right now.
Yeah.
Like
But
50s, low 60s.
I'm just
Yeah.
waiting for the
Chilly.
shoe to drop and it's
Sweater
going to be
weather.
30 below next
it's just
week.
going to start blizzarding
Yes.
everywhere.
In the ice.
Yes.
Okay,
No,
so our
honestly,
next
fair.
section, pits and peaks.
I kind of explained this to her yesterday.
Okay, so
But
she had a
it's
heads up.
Pit and then a peak.
Oh, for
so
me, I have to do this.
all of us do
All of
it.
us.
We all do
We
it.
all
I did not
So it's
contribute.
just
Yep.
like a high of your
Okay.
week and a low of your week.
We won't make you go first.
No.
Okay.
You can just like,
Is it veterinary related?
Nope. Doesn't have to
okay.
be. It
Okay.
can
Yeah.
be, but it doesn't have
Okay.
to be.
Yeah.
Your life.
Yep.
Got it.
You choose what you share.
I can figure that out pretty quick.
Okay, sure, I'll go.
Okay.
My pit is the rain. I'm not a rain person.
Yeah.
Too much rain the past 2 days. It's just annoying. And having to go outside when it's raining, like at work, is
Yeah.
really annoying.
Oh, yeah, the curbside stuff.
Yes. And
Yeah.
when you have to take your dog out on your lunch break and it's raining, it's just annoying.
Yeah.
My peak is I got my nails done today.
Oh, yeah.
I haven't, they were very outgrown. It was
Yes,
very
queen.
due. So
They look good still, though. Like,
Yeah,
for
they
being
did.
so grown out, you could not.
from afar, I was like, they look good from up here. But no,
Don't
they
look
look
close.
and they were just too long, like typing,
Yeah.
and they were just So that's
Yeah.
it. Just simple ones this week.
Okay.
Nothing crazy.
Well, we're a little bit different because my peak is the rain.
Okay, good.
Opposites.
attract, Devin.
That's about my only peak this week. I love the rain. It hasn't rained in a while, and I like it.
It has not rained in a while, so I'll
Yeah.
give you that.
Yeah.
I just like being able to stay in, like have an excuse to not go outside sometimes.
I like that part
Just-
about because then I
Yes.
don't feel as like lazy
and I
for
sleep
not leaving
really
my
well
house.
when it rains.
Yeah.
Mhm.
It's
I
soothing.
Yes, I like it. I like waking up after a really good sleep and then seeing that it's wet outside, and I'm like, oh, that's why I slept so well.
Yeah.
My pit is, I don't know about you guys, but we have been dead at work lately. Like, we are not getting many appointments, and
Look at our faces.
okay,
Yeah.
that's why I said, I
Okay,
don't know about
well,
you.
I'll just say what my pit is then.
I don't know. I don't do well when like we don't have anything to do. Like, I want to stay busy, so it's struggle bus lately.
That's okay.
We
That's how you feel.
like this afternoon. I think we had 4 appointments.
She spoke it into existence. Now you're going to get slammed.
I was
Okay,
I was
take
gonna
it.
actually say my peak was how busy we were yesterday, but
Yeah.
Guys are
Go
two
ahead.
opposites.
I know I love being busy.
I appreciate the busy
love
schedule. My pit from it was how like legitimately exhausted I was when I
Yeah.
got
Yesterday
home.
was insane.
My
Yeah, guys.
brain, my
Yes.
physically I was exhausted. I have I got home and sat on the couch. I got a glass of wine and I didn't even eat dinner. I just sat there and then slowly fell over and fell asleep starting at 8:30.
Mm-hmm.
Had to wake up around 11 to go bring the horses in the barn and then went back to bed. It was like something where I was like, I can't do bedtime for
Yeah.
Helen. I can't
You're just
function.
exhausted.
Well, you were sending
Yeah.
messages at like 7:30 about how to send rads out for
Oh, yeah.
Yeah,
you.
exactly.
So you
That
had a
explains
long
it.
The
night.
day ended very weirdly,
Mhm.
very
It was rough.
It was
crazy.
like insane chaos.
It was chaos.
It was
At
not-
five
not good
like
chaos.
4:30 hit and we didn't stop.
It was owners. It was animals biting people, nurses and owners. It was just.
Yeah.
But anyway, we got through it
Yes.
and we did the best that we could,
Yes.
and that's all that
I
matters.
think we did damn good.
But I was still recovering even today.
I drove the wrong way home last night. I'm not kidding. You can ask my husband. I told him when I got home, I was like, I went the wrong way.
It just happens sometimes.
I know, because like I was in like a daze. Like I was okay to drive, but like you know when like you get in your car and then you end up where you're supposed to be and you're like, how'd I get here? Like, did I run a red light? I might have. That's what I was last night.
Yeah.
But it's fine.
A peak. It was just a good weekend. It was my family, my mom and my nephews came into town. So it's always fun to watch Helen with the nephews. They love her. She loves them. They're running around yelling. She's babbling. It was just, even though I was tired on Friday, it was like just so happy to see that. And I rode my horse again. So that's always a good weekend. So
good.
Nice.
Yep. Your turn.
My turn. Okay. So, my peak is that I took my board certification exam on Saturday, and I haven't had to study since. So that's about 2 years of studying, and it's amazing to sit on the couch and not feel like you need to be doing something.
Yes.
So that's been fantastic. I don't know if I passed. I won't know till Christmas time.
What?
So yeah,
That's
maybe wait till after Christmas.
it's 45 days, so it'll be right around the time of Christmas, right before.
Are you kidding?
No.
It takes that long?
Mm-hmm.
Wow. I
Then
didn't
you
know
can
that.
just like you can just go through holidays and be distracted and like
about how I
or
failed it.
celebrate.
Yeah,
like-
we don't know. Could go
You
either
passed.
way.
I'm sure you did great.
Yeah.
How long was the
It
test?
was from 8 a.m. to 5 p.m. with an hour break.
Harrison's
I
gawking
did
in
not
the
think it'd be
background.
that long. That's like
Yeah.
a full day of work.
350 questions, right?
How
Yep.
did you remember that?
Was it
I just remember you
all-
saying it yesterday. I was like, wow.
That's
I was thinking in my
insane.
head all of
Yeah.
those questions.
Yeah.
Was it all multiple choice?
It was all multiple choice.
And then
It was
you could
pretty
get
difficult.
feedback on
It was pretty. Yep, you could you could complain about the questions in real time, which was nice.
To clarify, this is to get your exotic. What will be?
So ABVP exotic companion mammal board certification is what I'm going for. And so there was a credentialing process, and I passed that. I found that out in, I don't know, January, February, April, sometime. and then I was allowed to sit for the exam on Saturday. So pretty much the past 6 months I've been studying every single day for hours.
You took the whole week off to study.
I did.
Good.
And so that was my peak. And then my low, my what is it? My pit. My pit. Is we're trying to buy a house and it's not going very well. The whole process is very complicated, getting our mortgage approved and all that. So
It's stressful
getting
and time
there.
consuming.
So stressful. We're having to emergency paint some windows this Thursday because the VA won't let us buy the house without that. So
Emergency paint.
emergency paint. Yeah.
Crazy.
Yeah. So it's getting there. I think we're almost to a point where we will be okay. But I found out on Friday, the night before my exam, that it was all falling apart.
Oh no.
That we weren't going to get to close on Wednesday like we were supposed to. And so when you're supposed to like relax and like have a nice night to, eat good food and
Get some rest. And,
relax.
Just had to go right back into it.
Yeah. So
Yikes.
It'll be worth it, right?
It'll
It's
be
your house you want. Like it'll be
It's a beautiful house.
good.
Yeah.
Yeah,
have a
you like
party
it. I saw that
soon.
smile.
Yeah.
Okay, we have to definitely like set aside time another time, maybe talk about the credential process and like just. I feel like we've gotten a lot of questions on specialization and but we've just
None of us really have much experience with it, so it's hard to speak on it.
And some classmates, I mean, I don't know. I don't talk to them about the process, so
right.
So yeah, you'll have to like.
You can grab it.
Do
you want me to help you?
Microphone is like in the way.
you can lift it up to get.
That's on the table.
Well, anyway,
Okay.
send good thoughts, vibes, prayers, whatever to Dr. Lempert because
She
did it,
passed. She
and
doesn't need the good. She doesn't need it, but she passed.
No, I'll take it.
but she'll take it.
Yeah.
but
she
just
doesn't
like
need it.
relaxation
Yes.
to wait too. Don't
Yes.
stress.
No, I'm
Yes.
not stressing.
Yeah.
I don't have any stress left.
Okay.
And then left to give.
Yeah, no less. You're drained. Listener inquiries.
Okay, number 1, have you ever worked with wildlife? If so, what have your experiences been with wildlife rehabbers? From Anonymous.
Dang, I wish Lauren Winston was here.
I know.
Aw.
Has anyone?
Nope.
Have you?
I mean, so I don't have a rehab license, and so I try not to, but unfortunately I have helped a lot of heavily injured wildlife cross over the bridge. So that's unfortunately typically what we're doing. If they are rehabable, then they should be taken to a wildlife rehabber who can do that. But
you don't have to be a veterinarian to be a rehabber, right?
correct, you do not.
Okay.
And I think a lot of rehabbers probably kind of cross that line.
Got
Maybe,
it. Yeah.
Of what they do, but they're just trying to help
Yeah.
little injured wildlife. So
Yeah.
and they have a lot of talent. Yeah.
Yeah.
I wonder what the extent of like them being able to do meds and stuff like that is.
Yeah, that's a good question. It's probably similar to a shelter, right?
Yeah,
You
I
know?
would, or I'm sure they get just like direction in
Mhm.
general, and then
Yeah,
they have a
the
stockpile of what
oversight,
to do or
Mhm.
something.
Like
but-
maybe one vet on staff or something.
Yeah.
And they just
Someone they can consult with.
Yeah.
I think
Hmm.
so.
Yeah, we were saying, she mentioned Lauren Winston. She's one of our nurses, and she went to Africa, right, and
Mhm.
helped there, and
For a week,
Um,
showing on like a missions trip to
yeah.
help the animals there.
yeah,
Which is
that's
really cool.
Mm-hmm.
So yeah,
She went for 2 weeks.
She went for 2 weeks. So
Or
maybe
3
sometime.
weeks. She was there for
She
a
was
long
like
time.
darting animals
Mm.
and helping them.
I had some classmates do that too for like trips in school and whatever, and
I'd love to do that.
it looked awesome,
Yeah.
like with what they were doing, and
Mhm.
The one guy in my class in college, his externship was in Africa.
yeah, that's so. There's programs you can do it.
Yep.
So whoever wrote this question, I encourage you to look into if you're interested, because there's a lot of
Yes.
programs out there.
Not professionally, but I did have a pet deer and a pet raccoon.
Oh, well, there.
The deer had 3 legs.
Okay.
What was up with the raccoon?
We were driving in the winter and we saw a dead mama with 2 babies.
Aw.
So we stopped and we got the 2 babies. They ran up to our tire to like get warm. And then we had one of them ran away, but then we kept one of them whose name was Ricky for like the summer. And he was so sweet. Like seriously, probably one of the coolest pets I've ever had.
And then what happened?
Oh no.
We don't have to just talk about that.
Oh, okay.
Did you eat him?
No.
No, eat a raccoon.
I don't know.
I was still young. Probably like preteen.
It's okay. We don't. Sorry. Now we're talking about it.
No, but he disappeared, and I thought he just like went back to be a raccoon.
Oh.
But come to find out, my brother happened to hit a raccoon in the road
Oh no.
around the time he disappeared. Told me that years later. No, but Ricky, he'd like come up to my shoulder and like sit there and play with my hair. And then this is gonna be weird, but I have a pool. And I would like be floating on a raft, and he'd come down on the little steps in the pool and like stand up and put his little paws out and make his little raccoon noise, wanting me to come back to the shore. We were buddies, and I could like run around the yard, and he'd chase me. And
That's awesome.
feed
That's
him all the
cute.
crap.
People
But
get raccoons.
Alicia
and
had a pet
skunks.
I have a lot of
Yeah.
videos with him. And then the deer, ironically named Hoppy, we would like feed apple slices and carrots and bring water.
Mhm.
And, like she would actually, I don't know if it was a she would actually eat the apples out of my hands.
That's nice.
So
Where
that
did
just-
she live? In the woods?
Yeah.
And then we'd
So
like
why'd you
go-
call her your pet?
because we fed her.
Oh,
Why? No, but we saw that she was injured. She was on our fence line, and then every day we'd go out and give her apples and water.
Oh, okay. That's nice.
Okay, there you go. So we have some
So she
experience.
came with one
Yeah.
leg.
What?
She came with one leg.
3 legs.
3 legs.
Yeah, she came with 3 legs.
Okay.
Doesn't took
Well,
that leg.
okay. Was there like a nubbin left over?
Yeah, what it looked like.
I don't
What was
recall.
the state it was in?
I don't recall. I was very young.
Okay. Well, there we go. That's the extent of our
wild
wild
story a little bit, but that's what I remember.
Okay.
Speaking of raccoons, did you guys? This is totally off topic and sort of a tangent. Did you
No.
guys see the story
And
about
the squirrel
the squirrel and the
Oh.
raccoon that got euthanized in New
in
York?
New York.
I did.
They had a pet raccoon and squirrel that like were in their home. They like
it was
put them on
horrible.
social media. They were pets, and then New York like went into their house. And
His name was
raped-
Peanut.
Wait.
P''Nut.
Peanut was the
The
squirrel. I
squirrel,
think.
yeah.
But I think New York like raided their home, took the
Raided their
pets,
home.
and euthanized them.
But like
So
social media is devastated.
The reason why this happened, from what I understand, is that this guy had rescued a raccoon named Fred and a squirrel named Peanut,
yes.
and he very frequently posted them on social media.
Yes.
Apparently, somebody did not like the account and reported him multiple times on social media and to the State Department. And so, or whatever department it was. And so they got so many complaints that they came and investigated the house, and I guess things didn't go well. I'm pretty sure Peanut ended up biting one of the investigators. So then that prompted them to euthanize both of them. And there was a huge outrage over all of this happening.
Mm-hmm. Yeah. Internet's not happy.
Yeah, how do you do that? Like, what are the laws? Like, can you, I mean, I know there's rules or laws or guidelines when you own those exotic animals, even here in Indiana, but
it varies by state.
No, I could very well have rabies, but
I think you're okay.
I think I'd be dead, but
you probably have raccoon roundworm though. Did you go to Purdue?
Oh
yeah.
There's
that raccoon roundworm.
The Bayless ascaris.
If I've had that
goes to your brain.
So you think I have symptoms.
That's so sad though. Like everybody is so devastated because you come to love people's pets if you watch them for long enough.
Yeah, that's wild.
I would be so mad.
That squirrel was so fun.
But Peanut was defending its house. It's like a dog defending its house.
It was a black squirrel too, right?
Yeah.
I love those squirrels.
But like his name was like P-Nut.
Crying.
Peanut. I'm not crying. I'm just laughing. I mean, I just like an interesting conversation.
Mm-hmm.
I don't know. I don't know anything about these animals.
They were really cute, and he had coffee with his squirrel in the mornings.
I don't understand how they were allowed to do that. That's without owner consent. I don't understand that.
Oh, like go in the house and get the pets?
Yeah, and then euthanize them. It doesn't make any sense.
Like, would you do that with a dog?
No.
I think it probably has to do
the
with
same
the
thing.
legality of owning wildlife.
I'm sure there's a loophole they found.
And he had to have had a license, though. He posted it all over social media. Like, he had to have had...
Probably didn't.
Maybe not.
I posted my raccoon.
He doesn't have...
Yeah, they could have come and confiscated.
That didn't come for me.
Do you have social media?
I'm 12.
That's really sad,
when
though.
you were 12?
I'm
okay,
sad
we should
for
move
them.
on. We're on a tangent. Number 2.
I feel like we're 15 minutes.
Courtney, you do number 2.
Okay. Hi, I have... Oh, my goodness. Excuse me. Hi, I have an 11-year-old Australian Shepherd who started limping recently. He showed no signs of pain on manipulation of limbs, and after some x-rays, we discovered he has arthritis in his elbows. After 2 weeks on Rimadyl, there has been no improvement with his... has been no improvement with his limping. The vet casually mentioned that some people have used CBD/hemp oil. Do you all have any experience or suggestions for or against CBD hemp oils for arthritis pain? From what I understand, it's a tricky subject because it's not FDA approved for veterinary use. Are there any other products you should suggest for long-term use? I will also say my dog has already been on joint supplements for over a year just as early preventative care. Love the pod and always look forward to new episodes. Keep up the great work. Anonymous.
La
Anaquan. Save for the people in the back.
Okay, we should go back. Let's break down the meds.
Just had to.
Well, do you want to address her question first, or do you want to go over the supplements first?
Yeah,
I haven't heard about CBD being used for arthritis, just for like sedative effects.
I've heard of it being used
for pain.
When the only company that I know of, because I saw it at a conference, is called Ellevet, or Ellevet, and I just learned the information from that and saw that they have their own science and like research behind their products and stuff. So if people ask me about if they're like, hey, I'm using this or whatever, I'm like, well, I don't really have a lot of science to back it, or obviously FDA guidelines, whatever. But this is all I can tell you is like, I know of this company and it's up to you to get your own information.
Yeah.
That's kind of where I think everything still stands with those products.
We just don't have research to back it. Yeah.
I don't openly recommend it. If I'm going through a list of things to treat arthritis, then I'm going through everything else. I don't ever typically bring that up unless it's brought up to me. So
yeah, we have to be careful about what we say.
Yep.
But I think some of the problems are that there's a million products out there and there's not a whole lot of research behind them about, what they contain or how much they contain. And so it's good if there's a product that is trustworthy. And they've done studies. I mean, I know they've done studies on guinea pigs and rabbits.
Yeah.
I know those. And they can alleviate pain associated with osteoarthritis. So I think it's a really good adjunct. I don't know if I use it as a primary thing. But,
I think it's kind of one of those things. It's up to the owner's comfort and due diligence to get the information they want to find, because like you said, we still have to be careful with what we say with it too. So
it's not on our list of recommendations.
Suggestions for long-term use, or they've been on Rimadyl for 2 weeks. Would you recommend continuing Rimadyl? Maybe some gabapentin?
Yeah, I would
Librela,
say
Adequin.
I would say, well, if you're interested in starting other things, Librela is a good option. It's a monoclonal antibody that works at basically pain receptors, and so it helps block the pain associated with arthritis.
So once a month injection.
Yep. But while that's building in the system, meaning like they usually need 2 to 3 injections, I do keep the dogs on Rimadyl and then slowly take it away. I had just recently one of our patients say they wanted Rimadyl towards the end of Librela because they noticed the dogs start to feel it more, and they will use Rimadyl in between the time that they need the next injection, or they can get in for the next injection. So do you want to speak on Adequin? Adequin's a great option.
I love Adequin.
Yeah.
It's just expensive.
Yeah.
Especially for big dogs.
It's more frequent.
But I think it's a chondroprotectant, a polysulfated glycosaminoglycan.
Wow.
Say that 3 times fast.
Studying.
I am. I can't repeat that.
No, yeah, but it's an injection that's given there's a loading dose, and then it's typically given once a month, so it's pretty easy going after the loading dose the first month when you're giving it, I think, twice a week. But it basically helps lubricate joints, and it works. You can use like glucosamine chondroitin with it, but I use that with my dog, and it has made a big difference with her. She jumped over the fence for the first time in her life after we started it.
It's like a good bad thing.
Yeah. We can't contain her anymore. But we're like, we should probably stop that.
It's working too well.
It's working too well.
That's sweet.
But it's a good. And then gabapentin. Gabapentin's getting controversial. Now people are saying that maybe it doesn't work as well as we thought it did, which is disappointing because I love it.
I know. Yeah. We just need as many safe, reliable options, I guess, but reliable as well.
Yeah. Yeah, I mean, I think also if you've been using the Rimadyl for 2 weeks and haven't seen an improvement, there might be more going on, and maybe some further investigation with additional diagnostics might be needed. Because
or go longer too if there's a soft tissue injury on top of the arthritis. Takes like 4 to 6 weeks. They did
X-rays.
But I wonder what leg it is.
Resting.
Oh, it's
rest.
It's a front one. Yeah.
The one downside with Rimadyl, especially because he's 11, you want to check blood work.
Yeah.
Liver stuff.
Yep.
You want to monitor liver parameters if you're on Rimadyl long term.
Yeah. I always talk about like the pain pyramid for arthritis. So you have your different levels and things you add on each time if you need to. And supplements are one of them, Rimadyl, Librela, everything we talked about. But I like to use as another medical option is amantadine. I use amantadine a lot. That's for my kiddos that are not responding or just need another extra for quality of life purposes. And then I talk a lot about PT as well, as an option, depending on where we're at with age, severity, all that stuff. And the nice thing is all of these things we talked about, you can use together. There's nothing that's contraindicated. So it's sometimes just dependent on the owner, obviously, the goals, and then the dog and how severe they are. But I mean, long-term use-wise, there's Rimadyl you got to be careful about, like as you mentioned, and Adequin is a little safer for longer term for the young dogs, and Librela, I mean, it's not been out that long, but at least the studies so far showing good things. So anyway,
lots of options.
Next and last listener inquiry. Hey y'all, I'm a first-year veterinary student at Lincoln Memorial University. I love it more every day. I wanted to ask what you all know about specializing. What are things I need to be doing now to hopefully get matched to a residency later? I'm really interested in surgery, but of course that's like the most competitive specialty. Of course, there's no telling how my interests might change as I go through school, but I want to try to be prepared now regardless. I love y'all's podcast. From Rachel.
Dr. Lempert, take it away.
No, I did not do a residency, so I can't really give you advice on that, unfortunately. I think as a first year, I mean, you're just doing your best and learning as much as you can. I think learning for your knowledge versus learning for exams is a kind of a distinction that I felt like is an important one, because I feel like people just cram and then know things for the exam, but it's important to like learn and understand why things are happening, and you retain it better and you understand it better. So I don't know. I mean, what it's competitive. It is.
Yeah. I think, I mean, I don't know. I just know classmates that went into specialties. So I know it's a lot of, I mean, there's the interviewing, there's the grades, unfortunately, you still have to have to be matched well.
Like clock more hours in that specialty.
I think, I mean,
and I think like, I mean, you have to do an internship, right? And I think there's a lot of analysis of your performance there. So I don't know if you can match for an internship, then the next step is to do really well there. But first year, I feel like so many things change.
Oh, I know.
You're going to change your goals 15 times over by the time you get to fourth year too. And so just keeping an open mind, because I think when people discover like, oh, I like treating chickens, whatever. I don't know.
Yeah, I know. So, you learn just too much that you don't know until you go through it. But I guess, did you not have to do a residency? Can you talk about that?
Yeah. So it's kind of a lot, but essentially there's different ways to become a specialist, and there's different colleges. So American Board of Veterinary Practitioners is the college that I'm going through, and you can specialize in different species. So they have exotic companion mammal, which is what I'm doing, but they have avian, cattle, fish is the newest one.
Ooh, what?
Yeah.
Oh, that's fascinating.
Yeah.
Surgery on fish is so cool to watch. Okay, sorry.
Yeah. And then there's other colleges like ACVIM, so internal medicine, specialties, there's surgery. And I think for those, you probably have to do a residency. I think a lot of them you do. But for AVPP, you can do a residency, or you can have an experiential route, which it used to be 6 years of working in a practice that focused heavily on that. And they've, I think, recently changed it to 5 years. So
interesting.
Yeah. So you don't have to do a residency depending on what specialty you want to do it. For surgery, unfortunately, you have to do a residency.
Yeah.
And I think 2 internships, like it's like a normal rotating internship and then a surgery specialty internship. So it's a long road.
Yeah.
But
yep. Yeah. So make sure you want to do it. Like do all the shadowing, do all the questions, ask all the questions.
Yeah. Fourth year is a great opportunity to try all the things.
Well, good luck, Rachel.
Yeah, let us know.
Don't forget about that text messaging service. I know people, looks like they're using it still, but just don't forget about it. So you'll tap on the episode in whatever podcast provider you're using. Look at the top. It says send us an inquiry through text message. If you would like a shout out and to be mentioned on our episodes, go ahead and leave your name. Case collection.
Now let's hear a word from our sponsor.
Shoot.
Looking to protect your canine patients against parasites? Look no further than Simparica Trio, Serolaner, Moxidectin, and Pyrantel chewable tablets. The first chewable to offer triple protection from heartworm disease, ticks and fleas, and roundworms and hookworms. It's also FDA approved to block infections that may cause Lyme disease by killing deer ticks.
Use with caution in dogs with a history of seizures. Serolaner belongs to the isoxazoline class, which has been associated with neurologic adverse reactions. The most common side effects were vomiting and diarrhea.
Visit SimparicatRioDVM.com for full prescribing information.
Okay, case collections. I'll go first.
Okay, great.
So it was Friday evening. We'll just start there. Good start.
Stormy night.
It was 5:15, and it was a new client, new patient called in and said that their dog started urinating blood that day. And so obviously, they said it got worse throughout the day. So we said, okay, come on in. It was a Cocker Spaniel, intact. How old was he? He was young. He was like
2 or 3.
Yeah, he was young.
He was very young.
Under 5-ish or something. And so we start the exam. He was a little uncomfortable in his belly palpation, which I was like, okay, he's really nervous. He's shaking. Is he painful? I'm not quite sure. But then that was actually the cranial abdomen. Towards his bladder and everything, unremarkable. His prepuce was unremarkable. His penis had like a really small like ulceration on it. So I was like, but then they said they use diapers and stuff because he marks everywhere. So I'm like, is there just some friction? I don't know. So we had that on our list of problems. And then I did a rectal because he's intact and his prostate was boring, unremarkable. No fever. That's kind of the gist of it.
Dirty-minded. It's just this weird.
Oh,
prostate was boring.
I know.
She's over here chuckling.
Isn't it funny how like we are so immune to these things, and then in humans we're like, it's disgusting. So I had on my list cystitis, stones, UTI, mass, prostatitis. So we did an off the butt X-ray to look for stones and didn't see anything. Prostate was prominent, but nothing like huge. And the rest of the gut looked fine. And then we went to go get a cysto to get a sterile urine sample. And I was there looking at the bladder really quickly. Everything was boring. So I walk away to go tell the owner, like, okay, this is the plan. There were no stones, but we're going to submit to look at a urine and go from there. And we'll call you Monday. I get a call from my two lovely nurses over here saying, you should come look at this. And the fluid, the urine they pulled out of the bladder was dark brown.
It looked like betadine.
Black.
Yeah.
It looks like betadine.
Iodine,
Yeah. Straight, like just completely. And I was like, and it was like closing time after closing time at this point. And I was just so taken aback because I had in my head, which is not always great, but I had in my head what this bloody urine looked like.
Sure.
Basically how the case was going to go.
No.
Just was like, this is what it's going to be. No, don't ever do that. Because then I was like, well, bleep, beep, beep. We need to run in-house blood work. So we ran in-house lab work, and then I'm starting to think, like, did he get into a rodenticide? Like, can he not clot? Does he have platelets? What's all of the things? You start going like systemically, tick-borne, everything. And this dog also in the history was not up to date on vaccines, was not on any prevention. So the list kind of just expands from there. So on blood work, it showed a hematocrit of 38%, which was just low normal, like almost anemic. Platelets were normal. His total bilirubin was elevated at 4.7, I believe. I don't remember. I think the high end's like 1 or something. I'm trying to think. Oh, his amylase and lipase were too high to read. So I see that and I'm like, oh, that's why his belly was painful. He's got raging pancreatitis going on right now. So basically my biggest concern was, is this an autoimmune issue? Because he's a Cocker Spaniel and they are a textbook breed for IMHA. And then you go with all the list of like weird stuff, infectious disease, blah, blah, blah. So my biggest concern was it literally is like 6:15, 6:30 on a Friday night. And my first recommendation was to go to basically another ER 24-hour clinic to get further workup with like imaging and everything, like ultrasound, all of that. And the dog was BAR, thankfully, but the owners just expressed they weren't able to do that. They just spent a huge ER bill on their German Shepherd they had lost that week. I was like, oh gosh, this is bad luck. But we actually talked through, like, was there anything the dogs could have gotten into? Is there something, a combo here? And it didn't fit. So yeah, I said, okay, well, then I'm going to go with what is most likely. This is the best educated guess I can give you. And I think I'm most worried about autoimmune disease. So we started on immunosuppressive dose of prednisone. Hit him hard. If you know your doses, this was a 2.5 mg per kg dose once a day, and warned about the side effects. And I also started metronidazole because we did a rectal exam and the stool was super soft.
Nasty.
And I was like, he's probably going to have some diarrhea. So here's your Metro because he has pancreatitis. And I also started doxycycline to cover basically a lot of infectious diseases and said, please go to the ER if you see collapse, pale gums, blah, blah, blah. We did not do, and looking back, right, I think about what I could have done better. I could have done better by doing a blood smear and looking for specific cell types of the red blood cells that would confirm or support IMHA. And for those who don't know, it's immune mediated. I'm like missing one. Immune mediated hemolytic anemia. So basically the immune system is bursting red blood cells. So anyway, I would look at things under the microscope to support that. I also would have done probably a serum, not a serum, a what?
Saline.
Thank you. Saline agglutination test to see if things were like clotting when they shouldn't be. That's here nor there.
Yep.
Whatever. It was late on a Friday. And so I checked in yesterday, crossing my fingers, and he did great.
Which was Monday.
Over the weekend.
Good.
12 hours after starting the prednisone, he was peeing normally. No blood, no pigment, nothing. And yeah, so I called and said, okay, this is kind of confirmatory, not 100%, but pretty close to it. So we're going to recheck his CBC, just full blood work actually this week, and then go from there on tapering and all that good stuff. Since he's already on doxy, I'm not going to submit any tick-borne PCR. That ship has kind of sailed. And since he's doing clinically well, we don't need to focus their finances on imaging at this point. We did, however, another piece of information that's helpful for people, students out there, we got the urine and spun it down and looked at the sediment under the microscope because we were trying to see, like, are there red blood cells? Like, is it true blood versus is it just pigment that's creating this appearance of the urine? And there was nothing on the sediment, right? Like,
it was
didn't
weird.
see
I was, because I spun it down.
Right.
I looked at it and I was like, why am I not seeing any reds? And so I had 2 other techs look at it.
Yeah.
And it was just weird.
So it was supportive of pigment, which would be the red blood cells are.
We just didn't know about that at the time.
bursting.
We were all like, what is wrong with all of us? Can we not read urine?
Yeah. I mean, no, that's
It's just weird.
My brain was also spinning at this time, so my colleague also helped me a lot
Yes.
with this. I was Dr. McDivitt. God love her.
We all love her.
So that's my case.
Yep.
Great.
And we go.
I don't care.
Okay, I'll go.
Okay.
We had a 1-year-old unaltered little lady. She presented to us for vomiting blood. So she had vomited once in the morning, and it was mainly just like a lot of food, just everything in her stomach. And then there was like some pink tinge to it. And then she vomited again, and the second time it was just straight blood. So owner brought her in. Her temperature was normal. Her exam was boring. She wasn't super uncomfortable in her belly. And she was happy as a clam. She was wiggling around, so wasn't lethargic at all. So we started with some blood work, and that revealed neutrophilia with a left shift, which indicates infection. Inflammation, not infection. I'm sorry.
Could be infection too, but
yes, inflammation. Yeah. And then she had a hematocrit of 70, right? That's what you said, 70? Okay. And then some elevated white blood cells, things like that, whatnot. And then we also did abdominal x-rays, and those were pretty unexciting. She had some inflammation in her gut, but that's about it. So we pretty much treated for kind of HGE, but it wasn't. It's different. Correct?
It's just in the stomach.
Okay, in the stomach.
Hemorrhagic gastritis.
Okay, so in the stomach. So we treated with an injection of Cerenia. We gave her a therapeutic dose of barium. So we didn't do a barium study. We just used it to coat the gut and calm it down. We sent home sucralfate as well. And then we sent home oral metronidazole in case she started having diarrhea. She was not having diarrhea when we saw her, that they knew of. And then we sent home canned food, and we're also having them start omeprazole at home as well. We have not checked in, but I'll check in with them tomorrow.
Yeah.
So hopefully it was pretty straightforward.
Yeah. It was good outpatient care because she was bright
Fluids?
and happy. I mean, we didn't do fluids. She wasn't, I mean, she was a little clinically dehydrated, but her proteins were normal and on blood work. And so I figured it was, well, I mean, it could have been a little dehydration, but I didn't do it.
Yeah.
We were financially constrained.
Yes, that too. Yeah. She had a really gnarly skin infection too, but that was not addressed because we were using their finances for her GI stuff.
Yes.
Because she had a separate appointment today somewhere else for her skin.
Oh, wow.
Because they've only had her
I
for
told them to postpone it.
So
okay.
They've only had her for a few months. So they were establishing somewhere, and then this happened, so they came to us.
Yeah.
But like when she presented, we've never seen her before. And the history was she was unaltered. So we had that in the back of our brain. She had no records of vaccines. There was verbal statements stating that she had been vaccinated from the person he got her from, but they had no proof. So like we had this whole
like
list
parvo,
of
pine
things.
all
We
the
put
things.
her in ISO. Like we just had all these things, and then it was just some HG. So like it was kind of best case scenario.
Well, and I asked the owner too. In her history, she chews up things. So foreign body was on the list.
Yes,
but she had recently chewed up a little kid toothbrush, which I was like, that probably wouldn't cause an obstruction. But then also a sippy cup and plastic. So I was like, that probably provoked everything. So
we had like worst case scenario, and then it was just that. So we just treated her
you never
conservatively.
know.
But she is so cute.
She's very cute.
And she's a sweet dog.
Yeah.
Look, she's doing good.
All righty. My case is a 1-year-old unaltered male golden retriever. He presented for not eating. He had vomited once that morning and then was very lethargic after that. He was not defecating either. When he got here, his temperature was 99.2. He had a CRT of 2.5 seconds. Normal is less than 2 seconds, and very poor mentation. I went in there to get him for some blood work. We were going to do CBC, Chemelect, baseline cortisol, and also a drug test to look for THC. I walked in there and he is just laying on his side, looks asleep, like, yeah, he was not feeling great. So brought him back to treatment, and the doctor just wanted to feel his belly one more time. He was a little uncomfortable, like mid-abdomen. So I brought him out to the play yard to get a urine sample for this drug test.
Oh, it's this one.
Yes.
Yeah.
Yes. It's from a few weeks ago. And he's not peeing, so we're about to call it and go try a cysto. And then he squats down to poop, and it literally looked like urine, like his water broke from his anus. And it shot out, and then in the midst of this liquid dripping from him, a sock rockets out of his butthole. It was literally audible, and the girl that was helping me walk him, we just kind of looked at each other like,
what just happened?
So I called Dr. Fast, and I was like, so-and-so just pooped out a sock. And then she's like, what? And I brought him back inside, and she felt his belly, and it felt much better.
He also came in wagging his tail.
Yes.
He looked like he felt better.
Yes. So we shifted gears a little bit, and we didn't do the baseline cortisol, but we still did the CBC Chemelect, and then we did some abdominal radiographs.
Yeah.
We did do the drug test. It was negative. Blood work, let's see here. CBC and chem, leukocytosis, neutrophilia, chem panel normal. He was a little hypochloremic. Abdominal x-rays, there was some gas distension still, but other than that, unremarkable. We did some sub-Q fluids, some Serenia, and he is all better. So
He's like,
we thought it was me real bad, and it was just a little sock.
Was it a baby sock or an adult?
It was a
human
big sock.
It was a big sock. Okay.
Yeah.
At least it passed through, because
Yes,
those suckers.
it was amazing.
That's crazy.
Yeah.
That's the best case scenario, though. Just take care of it at the vet.
Yeah,
That's
that's
true.
so much better.
Oh gosh.
Well, no,
yeah.
he literally went out. Like, I mean, he looked high.
He
Like,
did not
looked
look
horrible.
good.
Oh.
He looked he was very, very sick. And Devin took him out, and then I was sitting in treatment. She comes back in, and he's like, hey! And Devin's like, something just happened.
And then I brought the sock in, and everyone's like, yeah, that smells like a foreign body.
It smelled like straight foreign body.
Ugh. Wasn't that same day you had another dog that
It
just
wasn't
pooped
the same
out
day.
roundworms?
No,
She just has a lot of patients that poop things.
Okay.
yeah, no, she was here for just like jet upset, I think. And Dr. Ham did a rectal on her and thought she felt like a little turd, so she wasn't having diarrhea. We were about to send her out the door, and then she just like squats and poops out a tampon and liquid diarrhea. Literally. Like, we were about to check her out, and then we're like, we're gonna do x-rays on you too. So Ham's like, oh, I was feeling a tampon, not a turd.
All Devin's patients just poop out surprises.
No.
Well, at least they're coming out.
Yeah.
They're not
matters.
forcing it.
We have a patient, every time she comes in, she vomits balloons.
Yes.
It's a
It's
Frenchie.
Eloise who's bad.
God.
Yes.
And she
But-
went to the she had to go to the ER because she was vomiting 10 times.
Yeah.
Did
But
they-
no,
was
every
she-
time
what
she's in the
happened?
clinic, like, we don't
She
give her
poops
anything.
balloons.
Like,
She-
like she's there for an annual.
Yeah, and
Yeah.
she poops because she gets nervous, and every time without fail, there's balloons in her poop.
And every
And
time
it,
we
like,
bring it
comes
up,
out
and they're
as
like,
a balloon. And
yeah.
you can just
Like,
every
it's
time.
not like a turd with a balloon in it. It's just like
who are these people that have so many
poop
balloons?
covered
She's a
balloon.
Boston Terrier.
where are the balloons coming from?
Maybe they have birthdays.
No, she told me.
They're
I
clowns.
mentioned it every time, and she's like, "Yeah, she likes to get those. I get the cheap ones now, and she just eats them, and they always come out." And I'm like, "Okay,
Like they're giving.
I don't recommend that.
They're giving them to her.
No.
Oh.
Like she gets into them because she's got kids. And
Gosh,
But they don't.
Welcome.
I don't know if they do any. Like
Yeah, they're not.
she can get to them.
Yeah.
Repeated.
Goodness.
Anyway, it was a fun poop story.
Always entertaining in the vet world. All right, listener question. Here we go. I heard there are 2 types of exotic vets. I'm not sure what they are, though. I was told one was more of a zoo medicine and the other one was more domestic animals such as rabbits, reptiles, birds, etc. I'm looking forward to being an exotic vet working in reptiles, birds, etc., but I also want to work with big-scale animals like lions and other zoo animals. Is it possible to do this? I know 8 years of schooling is already enough to become a veterinarian, but I'm willing to put more schooling on myself to be able to learn about zoo animals too once I become a veterinarian. And if you are if you are either exotic vet, what is your day-to-day life like? Do you do more surgeries on exotics? I know this depends on where you are, but I'm curious to know what it's like for some, and what animals have you treated? Thank you so much in advance. Anonymous. Take it away.
I can't speak on it.
Take it away, Dr.
Okay,
Lempert.
so there is a specialty with zoo medicine. So there's a whole college of like zoo medicine, whatever specialty. And that sounds like probably what you're interested in doing. I think it's also very, very competitive because a lot of people want to be zoo vets. So I think your best bet is to spend as much time volunteering, shadowing, doing whatever you can at zoos. And then the kind of exotic vet that I am is more of like the domestic, so the reptiles and the rabbits and guinea pigs, that kind of thing. And you don't have to be a specialist to work with them. You just have to have an interest and put in some extra work. But typically, I'm not working with lions
or birds.
Or birds, yeah. But you can work with reptiles and birds at zoos. So that sounds like what you're interested in. It's got to be very interesting every day.
Oh gosh,
Sure,
yeah.
it's always different.
But you're right. It's extremely competitive. I feel like I just know that through learning from classmates who wanted to do it or tried really hard and like that.
Yeah.
So
That would be cool.
it would be interesting.
You could
for
treat so
sure.
many different species.
Yeah.
Isn't getting into a zoo though difficult as well? Because I
Very,
looked
very
into doing my externship at the zoo when I was in college, and the process of just getting in there is like nearly
There's not that many
impossible.
zoos.
Right.
No, it's just it's so hard.
Yeah.
Lauren, your technician, she volunteered there for, I want to say, over a year.
At NDU.
Yeah.
Mhm.
And she was never able to get an actual job because it was so competitive.
Yeah.
Yeah. It's crazy.
Yeah.
So, I mean, but I guess, yes, you can do both. Like they have bunnies at zoos, right? So, like,
Do they?
I mean, in the I know the Fort Wayne Children's Zoo does in the farm section.
I don't know if I've only been in the Indianapolis
In the farm
one, so-
section.
Yeah, there's a little
Yeah.
farm
Yeah.
section.
I used to live there. I know. My parents took me there.
Yeah, it's great too. But
But you can do a lot of interesting things in general practice, seeing exotics. So
what is your day-to-day life like?
my day-to-day life, it's actually pretty variable. So since we see so many species, I never really know what to expect. If I'm spaying a leopard gecko or amputating a snake's tail, or on Friday we're spaying 6 Flemish giant rabbits. So definitely it's always interesting. It does not get boring. And so that keeps it fun.
So do you do more surgeries on exotics? Yeah.
Oh, yeah.
Yep.
Mm-hmm.
So talk about like what's the difference from anesthesia for a bunny versus a cat or a dog? Like what do you have to look at?
We do a lot of the same things. So when we're doing anesthesia on a rabbit, we're placing an IV catheter, we're intubating them, we're using all the same monitoring equipment. So we're practicing at the same level as we would for a dog or a cat. Some of the drugs are a little different. Some of the anesthesia parameters are different. So the things that are true in dogs and cats are not true in rabbits for like anesthetic depth and stuff like that. So just being aware of those distinctions. Some animals are not so easy to intubate. So guinea pigs in particular are really difficult to intubate. So there's challenges everywhere. But, you know, I think you just have to be brave and willing to try new things. So it's because then you've done it once and then, you know, now you know how to do it. But you just have to kind of put yourself out there. So
what's your favorite exotic surgery?
Liver lobectomy in a rabbit.
Oh my gosh, that was so specific. Do you get those a lot? Yeah.
So rabbits like to torse their liver lobes. So they twist on the stalk and it cuts off the blood supply to that lobe of the liver, and then it gets necrotic and it starts bleeding internally, and they feel awful. They're anemic, and you can go in there and surgically remove that liver lobe and they feel immediately better.
Wow.
Have you done it at All-Star?
No, I haven't yet.
It's like, how did I miss that?
Right? No, but you know, they come. Interestingly, the more recent paper showed that. Never mind, I'm confusing that with rabbit appendicitis. But it tends to happen during certain seasons, which is, I think, interesting. So spring and fall, like 90% of the cases. Yeah.
Huh.
So then you get like these rash of them. You do like 3 liver lobe torsions surgeries in a row. And then you don't do one again for a couple months and then come again. So
yeah.
Do you think it's because of like the nutrition and like horses, right? Because their feet can flare? I don't know.
We don't really know why they do it.
What?
It's I think a theory, the most recent theory I heard is that their stomach distends for whatever reason, and it stretches the ligaments of the liver, and then they, like, when rabbits are really happy, they do something called a binky.
The binky's so cute.
And maybe they binky so hard that their livers are flipping.
Binking too hard out there.
So what's a binky? Okay, yep. So when rabbits are really happy and really excited, and they can't contain their excitement in their tiny little bodies, they start sprinting around and they do these little kicks and flips. And you just kind of have to see it.
You should YouTube it. It's so cute.
YouTube it, yeah.
They're so happy.
Yeah. It's ridiculous.
Bunnies don't, or I guess rabbits, they don't like do any sort of hibernation, right? Like that that couldn't play a role in. Like they don't eat a bunch in the fall to prepare for the winter.
No, and I don't know if I've ever been asked that before.
Well, there you go.
Thinking outside the box. I love it. Wow.
That's so interesting. Yeah.
Lobectomy.
Interesting.
I have a bunny at home, so I'm just thinking about all these things that I need to watch out for. But at least I have someone who can fix it.
Forgot you had a bunny. Yeah, Jacob begs me on a weekly basis to get a bunny.
Oh, really?
He had them growing up, and so he wants a lop.
Okay.
There's
really
a lot at the shelter, right?
A lot
he really wants a
House Rabbit Resource, Indiana, ERPS, Critters
We worked with
Chance.
ERPS in school.
Yeah.
That was our rescue we worked with.
They actually don't have too many bunnies right now.
Yeah.
They got a lot of other animals.
Maybe one
Indy
day.
Claw. Yeah. I can help you. Let me know.
I know. I have somebody
You're
now,
lighting
so.
up talking about bunnies and binking. It's so cute.
It's hilarious. I was on a walk with my dad this weekend, and a cottontail just ran across the road, and I got really excited. And my dad was like, "Really? Like still,
Still, that's so cute.
And I was like, I think that shows I went into the right profession. Like every day, every bunny I meet at work, I am still equally excited about.
Yeah,
so
that's so awesome. Yeah,
awesome.
So you have to get one yourself. Right?
I have 2.
Oh, you
I was
do
gonna say,
have
yeah, she has
two.
bunny.
Yeah.
Which kinds do you have?
They're lops.
Okay.
A mini lop and a
They're really
Holland
cute.
lop. They're.
Oh, I didn't know.
I'll have to show you pictures. I didn't
Okay.
know that you didn't know.
I was like, you have to get this girl a bunny.
Obviously.
Somebody,
No, yeah, she is
please.
Yes.
Okay.
Couldn't live
Oh,
with that
Bunnies are
bunny.
cute.
So exciting.
Well, thank you for being on our podcast.
Yeah.
with us.
having me. So interesting.
You'll be back.
Yeah.
I'm sure.
I'm sure there's going to be lots
We
of
could pick your
follow-up
brain for
exotic
like
questions.
2 hours.
I'll get a case next time.
Okay, thank you so much for tuning into another episode of the Veterinary Roundtable. Remember, send in those questions and leave us a review if you enjoyed this episode or previous one. We'll see you next week for another episode of the Veterinary Roundtable. Bye.
Bye.